Hello, my friends. It is day 114 since loose skin surgery. I had the fleur-de-lis pendectomy, which is a hip to hip and up the middle. I am about 8 days away from 4 months. I had it on June 17th and it is now October 9th. So 6, 10, yeah. So October 17th will be 4 months. And so this is 3 weeks, 3 years, 3 months. 3 weeks, 4 weeks. The weeks are weird now because there's longer weeks, shorter weeks. But we're going to do a skin reveal and share what it looks like to give you some context. I still have my skin on my chest. I'm hoping to get that done in January. It is now October. As far as an update for the swelling, well, yeah, let's go swelling. So, swelling has gone down, but I'm still very much tender and bruised here. And so this is still very much tender. So if I press that tender, I get moments where this is very sensitive and very tender, still very bruised. I think the swelling has gone down significantly. A couple things as far as what you'll notice. First, the stitch abscess is closed. It's been closed for a while. I can put my shorts and stuff like that on there. As well as that pin size hole did open up, had a little bit of bloody discharge early last week. That has since closed. And so it's been kind of going through back and forth. And so it is now at the point where it is closed and it looks good. Everything's still red from the incision, but it's slowly looking at like it's healing. A lot of the swelling in this area has gone down. You should be able to see a lot of the muscular area and the oblique areas. I'm working on getting abs, but that's going to obviously take a while. And then, I'll talk about the skin and what everything looks like, but just want to quickly talk about a couple of good things that are very beneficial. First, this scar tape. I got this actually at Walgreens, but there's really good ones on Amazon. I'm putting this scar tape directly on any incision area, and this is just first, it talks about how it accelerates healing. There's nothing special into this. It's essentially just kind of sealing both of the incisions in place, or it's sealing both skins that are coming together. This kind of gives it some reinforcement. So I recommend it. I feel more secure when I wear it, so I do wear it. Vitamin E oil I'm putting on the skin, which you can see here. The vitamin E oil is just straight vitamin E oil from Walmart, and I'm putting it on. And then I'm also using Arnica. It's an Arnica roll-on. It's found at Walmart, the Equate brand. And it's a roll-on, and I'll just roll it on any areas. And so that Arnica has been fantastic. The vitamin E oil on the skin, the scar tape, those are 3 kind of things that I've had that have been great. And then any kind of like incision or pin size hole that I had, I was putting Manuka honey over it, and that has been fantastic. I found that at Walmart as well. I wear my compression binder every night still. I've not worn it a couple nights, and it feels very weird. I feel very vulnerable. And so I still wear my white binder, and I'm going to probably wear it for 6 months up to a year. I don't wear it every day or out and about, but overnight when I'm sleeping, I do wear it. It provides a little bit of security and helps with compression. You can see I just did that, and it feels tender. Still feels like there's some swelling there. Interesting thing before I do a reveal, trust me, I'll do a reveal, but I did some red light therapy at Planet Fitness. They have a area where it's a red light therapy where the bottom moves. I think it's called the total body something. It's like in the black card area to where you get like the massage, the hydro massage, the red light therapy. I did that, and I noticed that my belly button was greenish, and any area below my incision down was greenish as well. So I'm not sure if that has to do with blood flow or what, but this area was very pinkish, but then this was very green. So red light therapy I heard is very good for scarring, and so I'm going to continue to use that and trying to red light therapy and provide as much healing as possible. So without further ado, yes, we're going to do the reveal. I like to start off and point out really important topics before the skin kind of just dominates the conversation, and there's just kind of a look of what's this look like, what's that look like, because it's very important to know what's going to help you, especially through surgery. Some of you have even mentioned you're sending this to others who are going through the surgery, and this has been helpful guide for them. So just know that this is 114 days. This is just shy of 4 months of post fleur-de-lis pendectomy. Okay, so you ready for it? Again, I still have my chest. And so this is where we are. Let me roll this here. Okay, so you can see a lot of the swelling. I'll do some like muscle tightening here just to kind of get some context on what you probably wouldn't be able to see before, but what you can see now. I am back in the gym strength training. I am back lifting with no reservations. I'm deadlifting. I'm doing crunches. There's no real hesitation. The crunches at times feel a little tight, but overall they're good. I'm back to running. I did my first competitive 5K this past weekend. But you can see here, because I have my shorts here, it's lifting this area up, which this seems very kind of sensitive still to press on. But when they're actually going to do the chest, they're going to bring this up. And so I'll essentially have a lifted, this will lift likely when this goes, because this is still dragged down. So that's where we're currently at. If you want to kind of see, if you go back to some prior videos, I haven't yet, but just to see some prior videos on what the midsection looked like. Again, this feels like it's some excessive, but then also I don't know what the muscular structure looks like because I've never seen it before, but I'll do some breathe in and breathe out just so you can kind of see the structure of what it looks like. You can see it, like I'll try to flex my obliques, but then I just have this. So this is something that could need to be taken care of. If I push that back, could, but also on the sides you could see, depending on the lighting, where there is some sort of midsection structure. Got to see where things are at. So that's a stitch abscess. It is now closed and good. That was the pin size hole, which is good. And again, we're just shy of 4 months, so there's still swelling. This is still going to go down. I'm working on as much as I can, building muscle and minimizing body fats. Again, this is a separate surgery that I'm hoping happens in January. I have a GoFundMe. If you can contribute to the GoFundMe, that would be awesome. Essentially, when I get to the $500 threshold, then I can call the doctor and ask about a particular date, and then I would have to have the funds 1 month before the date. And so I plan on talking about that a little bit more at the end of October, just to give it a couple months for it, because I had set an original goal with my original GoFundMe, but I only raised half. So this is essentially the other half to try to get this taken care of. And essentially what she talked about is going all the way back to here and just bringing it in and lifting it up. She may potentially need to go in here and get rid of some of the excess. I don't know. But I know it's just the chest. I do have, just, you can see, I've got quite a bit here that can still. But as far as weight-wise, I haven't really changed much as far as weight. I've been weighing myself, and essentially what I weighed before the surgery and what I weigh now is pretty much the same, even though they took 12 pounds of skin. But this is where we're at. Kind of see. What am I in classic physique? That's where they do the second. So that's where we're at. I'm not sure how long this video is. 9 minutes in, so thanks for sticking with me for 9 minutes. If you haven't subscribed already, please do. I'm just shy of the 500 subscriber threshold, which ideally I'd hit 500 subscribers, then I could monetize the YouTube channel, then one of these videos just gets millions of views, and then that alone pays for the skin surgery. Boom. And then I can get this done. So here, there's for wishful thinking, but I'll see you in the next video. Day 114, just shy of 4 months, pendectomy, loose skin recovery. That's it.